Hello, my name is Tracy Bear, and I am here to discuss with you my alternative healthcare facility that I chose. I chose corrections, so we're going to talk about the Florida Department of Corrections. This is for Miss Shay's healthcare leadership class, HIM 2810. What we will discuss, we will define what a correctional facility is. How many correctional facilities are there? How much money is spent on healthcare in these facilities? Privacy issues, accreditation, the aging population, and we will have some questions and answers. Florida Department of Corrections. What is a correctional facility? Well, according to Law Insider, correctional facility means a state prison, a prison facility, a community correctional center, correctional farm, state reformatory, or probationary recovery camp owned, operated, leased, and supervised or contracted by the state. We have over 143 facilities statewide, including 50 correctional institutions, 12 FDC operated work release centers, 2 road prisons, 1 basic training camp. Two of the largest facilities in Florida. One is in Rayford, which is the largest male facility. It's called Union Correctional Institute. It has 2 facilities there, and it holds over 2,000 inmates. Florida State Prison is one of the other facilities that's there, and that is where the death penalty is carried out. The largest women's facility in Ocala is called Lowell. It has a population of over 2,000 women. It is located where the women's death penalty is carried out, and there are 3 women on death row currently. Accreditation. The main accreditation body for correctional facilities is the NCCHC, or National Commission on Correctional Healthcare. That's a mouthful. They cover standards to improve the quality of healthcare in jails and juvenile facilities. It covers areas of care and treatment, healthcare records and administration, personnel, and medical legal issues. They also provide certification for healthcare professionals in jails and prisons. These certifications, once you recognizes the professionalism of individuals in those facilities, and there are specific ones you can get. You can get one for an RN, you can get one for mental health, you can get a physician can get certified, and then there is an advanced certification, and that is when you have worked for these facilities for approximately 3 years. The FDC budget. The budget for 2020 was over $2.7 million. The healthcare portion of that is 21% of the budget at $568,000. There is over $1 million for safety. The other things are community corrections, which is including people that are on bail or probation, that type stuff, education and programs for the prisoners, and then the administration budget which is for papers and administration part of the Florida Department of Corrections. The medical coding scheme for the Florida Department of Correction includes ICD-10 for diagnoses, CPT and HCPCS for outpatient services and therapies, the DSM-5 for diagnosis of mental disorders, and the ICD-10 PCS for inpatient procedures. The aging population is aging. In 2020, nearly 27% of the population in the prison systems is 50 and older. Health services account for 22% of the budget, and the elderly population has increased over the past 5 years by 4.8% in 2020, but there was a 717% increase from the population from 1990 to 2009, according to the Asphalt study. Of these, it breaks down to, according to the FDC website, that there are 34% that are between 50 and 54, 29% that are between 55 and 59, 19% which is between 60 and 64, 10% between 70 and 74, 5% that are 80 to 84, and there's 2% that are from 85 and above. And yes, they have 3 inmates that are 95 and older. 95 years old. That's old. Privacy issues. With any record that you have, health record, it is required that you keep these records, and they are under the umbrella of HIPAA as a protected health record, and it otherwise meets the definition of such and maintained and transmitted by the healthcare agency. Part 2 of HIPAA does not permit PHI about substance abuse to flow or to from correctional facility without the consent of the prisoner. When an inmate is discharged, they are able to get these records. It's available to them just like if it's available to me after I've been discharged from a hospital. I can get the records from that hospital. Same thing, because it's all under the umbrella of HIPAA. FDC of the future. They represent the FD workforce, 22% of all state employees. They are developing an electronic health record system to replace the old outdated paper ones, and that's in the tune of $15 million. They are to build a 550-bed mental health facility called Lake CI Mental Health Facility. The FDC plans to replace 20% of all of its on-site health care with telehealth services. With the COVID outbreak, telehealth services have increased tremendously, and with that, the FDC plans to incorporate that into their working healthcare system. In conclusion, the FDC holds over 80,000 inmates and supervises nearly 140,000 in the community. Those are on parole, probation, those type things, work release. In 2010, there was a cost of $400 million in healthcare costs for the elderly population. The FTC employs over 25,000 people. The increase in an elderly population will increase the amount of healthcare costs. Most Americans will not receive any of this healthcare from these facilities. At least 4.9 million unique individuals are admitted into prisons and jails each year. They will be adding telehealth services to help lower cost. They will be adding the electronic health record to improve care. What is the largest male correctional facility in Florida? That's the Union Correctional Facility in Rayford. What is the largest female correctional facility in Florida? That is in Lowell, which is in Ocala. What facility is majority of the death penalties carried out? That is in the Union, Florida State Prison. What type of facility does the FTC plan to open? They plan to open a 550-bed mental health facility. Once an inmate is released, does he or she have the right to those records? Yes, they do. Do many facilities have electronic health records? No, they do not. What percentage of the FDA budget is for health care? There is 22% of the budget for health care, $500 and something thousand. What was the increase in 2020 for elderly population? That was 4.8% increase. What percentage of the aging population is 50 to 54? And that's a 22% of the elderly, of that 20% that's elderly. 50 to 54 is about 20% of that. What is the leading accreditation body for these correctional facilities? And that's the NCCHC, which is the National Council for Correctional Health Services. I want to thank you for listening to my presentation, and I hope you have a great day. And to all the veterans out there that are listening and will listen, thank you for your service on this Veterans Day that I'm recording this, and I really appreciate your service. It means a lot to all of us. Thank you.